Next muscle of the posterior leg is going to be the tibialis posterior. To review its origin and insertion, it comes off the proximal tibia and fibula as well as the interosseous membrane, and then it's going to run all the way down the leg here, go behind the medial malleolus, so it's part of that Tom, Dick, and Harry that goes behind the medial malleolus, and then its insertion point is all across the sole of the foot into just about every one of the tarsal bones. The main action of the tibialis posterior is that plantar flexion as well as inversion, and you can see the insertion point is getting approximated to where it originates from, just in that position there. For the muscle test, what we'll do though is have the patient flip over into a supine position. And we're going to put his foot back into that same position right here, plantar flexion with a little bit of inversion. And then what I'm going to do is support across his ankle here, and then he's going to hold there nice and strong as I try and pull his foot towards me. And slowly load in and slowly load out. So we're trying to do this sweeping motion here, and he's holding it there nice and strong. Again, you can lean your body weight back a little bit, so hold there, and that way I don't have to use as much upper body strength to check that muscle. For a variation, what you can do is bend the knee a little bit. Same thing, he's in a plantar flex position, comes into a little bit of inversion, support my shoulder into his knee, and again you're trying to sweep the foot across the table, hold there nice and strong. For a prone variation on the tibialis posterior muscle test, what we'll do is again pull him into plantar flexion as well as a bit of inversion, and then what I can do here is stable right across the top part of his ankle, so hold there, and then what I can really do is lean my body weight into it as I try and sweep his foot outwards and towards me. What's nice about this position is you may be able to catch a bit of a palpation of the muscle. Yeah, right underneath my fingertips, I can feel it right away as soon as he engages. So it's a really nice way to get the contraction and the muscle test all in one, as well as the palpation of it.